Hi everyone, welcome to my channel. I'm Nursiana, and in today's episode I want to talk to you guys about hypoglycemia management. And to refer to the management protocol, we will be using insulin subcutaneous order and blood glucose record form. This form can be found on pretty much every ward because we do have people with diabetes of type 1 and type 2, and this form will give you all the directions that you need to follow when you're managing hypoglycemia and also hyperglycemia and administration of your insulin. In particular, in this video, I want to pay attention to hypoglycemia because there are a few mistakes that people make when giving carbs to the patients when their BGL level go below 4. And also I want to pay attention to hyperglycemia in a form order where people do not report it in time to the doctors when they have consecutive high levels of BGLs in their patients. And we will also touch bases on symptoms of hyperglycemia and hypoglycemia. Okay, so I'm gonna flip the camera now and I'm gonna go through this form with you guys. This way it will be easier for you to see each and every section, and we will just discuss it all together. Okay guys, so this is the form. It consists of a couple of pages, and we will go now about each page, and I will cover sections that in my opinion are important, as I mentioned earlier. So the front page, it has a sticker of your patient, usually here, and here it has the guidelines for medical officers managing blood glucose level. So this is pretty much for your doctors when someone has episodes of hypo and hyperglycemia. Here it tells you the types of insulin to give. Here it tells you how much to give, how many units according to the sliding scale of the BGL, and also the weight of the person. So this information here is mainly for the doctors to follow as a hint, but for us nurses it's always good to read it through and just be aware, because doctors also do mistakes. When you open this form further on in the middle, you have another sticker of your patient here, and then you have full of sections, 2 pages. In this section here, you have the frequency of monitoring your BGLs. Okay, you have standard, including 9 o'clock at night, you have 2 o'clock in the morning, you have 2 hours post meal, and you have others as well. So usually on my ward, if someone is on metformin once or twice a day, we usually monitor their sugars BD, which means twice a day. Unless their sugars are fluctuating and we need to keep a close eye, then we will do a standard. If someone is on insulin, then we will do a standard tick here, which means every time pre-meal plus 9 o'clock at night. And then we will also check in the middle of the night, which is 2 o'clock in the morning. Then down here, these are your types of insulins written here. So this is your order for the insulin, okay? You might have someone having insulin at breakfast time, lunchtime, dinner time, and then slow acting pre-bedtime, which is your 9 o'clock at night. You will have a type of insulin, your print name of the doctor, the signature of the doctor. Sometimes you might have additional insulin order here as well. And then you will have a date. Remember that you need to give insulin by the date. If the date is not stated, then you need to ask the doctor to put a date on the order. You can't give insulin if there is no date. And my suggestion to you all as well, if you know and you are on a PM shift that tomorrow the patient usually gets his insulin, ask your ward call doctor to chart the morning doses of insulin for the upcoming shift, because this will help them a lot in the morning, because mornings are very hectic. Then just beside it, this section here, this is your supplemental insulin orders, which is also your sliding scale orders. So most of the sliding scale orders, they're usually given with meals, and doctor usually ticks it here. But there are some exceptions, and it might be 6 hourly or it might be others, and it would be here twice a day or 3 times a day as a designated time. They would put, for example, 12 p.m., then let's say 15 and then 16, or 18, I'm just making it up. But I had patients who've been here on 3 different times a day on insulin, and you have to give it on a sliding scale according to these times, only on those times. Here is your sliding scale, which tells you here that if your BGL is between 8.1 to 12, you will here give a particular number of units which will be written by your doctor. You don't do it by yourself as a nurse. All what you need to do, you just monitor BGL to check what number the BGL is sitting at, and then according to that number you see how many units you will need to give. Again, you will need to have a date here. It will be just written only once here on a day that it's been written, and then you just follow this all the time. This one here is a little bit different to this order here. Here you will need to have every single day date to follow. Here it might be just written once. If there have been changes to the sliding scale, they will put the changes here and they will date it, and you follow off the second updated one, which will be your latest change. Here you will also have a type of insulin, so you will need to follow which type of insulin you give. It could be the same insulin that was given in the morning if someone is on pre-meals insulin, and also a sliding scale. You might have, for example, Nova Rapid or Nova Mix given at breakfast, and also as a sliding scale, so to balance it up. What usually sliding scale is used for? For example, if the dose of insulin in the morning is not covering the BGL levels that the patient is on, because they fluctuate, sometimes they go up, sometimes they go down, sometimes they stay hyper for a couple of days, whatever, we need to give small amounts of a sliding scale of maybe the same fast-acting insulin type to keep the person in a balanced state. Then here in this side, here in the corner on your right, this is your stat and also, this is your stat and also phone order of insulin. If, for example, someone is not on a sliding scale, or only on a sliding scale but not pre-meals insulin, or maybe only pre-meals insulin, let's say only breakfast and bedtime, fast and slow acting, it might be that the BGL sometimes go up or down. If it goes up, then you will need to contact the doctor, and the doctor will come and start additional dose, which means it will be given only once at that particular time. That's why it's called stat dose. And this could be done here by person when the doctor comes and write it by themselves, or you might give them a call, and if they are busy on a different ward, if it's an evening and you only have 1 or 2 ward calls per the whole hospital, they will ask you to take a phone order, and you will write here the phone order and then sign it when given. Any insulin from these sections given to the patient will be written here. So usually doctors fill in this section. They will write types of the insulin the patient is on. It could be a combination of a slow acting and fast acting insulins. And then when you will be given insulin from any of these sections, you will refer here to the type of insulin. So if you're given, for example, here Nova Rapid, let's just write it down, Nova Rapid, to make it more visual for you guys. Nova Rapid, and here will be optician. Okay, so if you given, for example, Nova Rapid, and let's say the sugar level on a sliding scale was 11, okay, and the doctor, let's say, put to give 2 units of today, okay, of, let's say, Nova Rapid. Okay, let's just pretend, yeah, with meals. So you've given 2 units, or you're about to give 2 units. You go here into this section and you write 2 units in front of Nova Rapid, because this is what you're given, right? Then you would write your BGL. Let's say BGL was 9, so it went into this section here. Let's say 9.0, time 10:30, date 18:11. They are on a standard check. Okay, so this is how you would fill in. And then here, the time that you given the actual injection, let's say you've given after 5 minutes. Did I put there 10:40? Let's say 10:45. Okay, and here will be the signature of the nurses. So it would be my signature or your initials, and will be initial of the nurse number 2. Okay, here you can put any comments. We usually rarely put any comments. Okay, if you give an optician, for example, pre-bed, here your type of insulin will be optician. Okay, and the date is of today, and they want at night optician to be given, let's say, 20 units. Okay, and here will be initials of your doctor. I'm not going to fill in anything else because it's usually done by the doctor. So you are checking your BGL later today at, let's say, 21:00. Yeah, and you found that it's going to be standard here. Okay, you just give it. You find that you're not low. You sit in, let's say, 8.1. Okay, you're sitting at 8.1. Okay, you go to optician and you write here in the column of your time that you're checking now that you're given 20 units, which is your 20 units here of today. Okay, you put in front of insulin because this is what you're given. And then once you're ready to give this 20 units, you put the time when you're giving it, let's say 21:05. Took you 5 minutes to prep it. Again, your initials and initials of nurse 2. Okay, so this is the section where you put different types of insulin, okay, and the amount of units that you're given according to this order here and according to your sliding scale. Okay, now the next section, and yes, and if you have your start dose of insulin type, let's say NovaRapid, you will put it here in the next column. Sometimes you might have 2 different types of insulin in one column because you would give, let's say, one of the slow acting and one of the fast acting. So you will put them here under each other. Okay, and you will go with your nurse, with the second nurse, and you will prep your injection. Now, in this section here, this is a big section. It goes by day. Oops, sorry, that's the handle of my camera. So it goes by day. So this will be your day, and you will put 18, 11, 20, 23. Okay. So here, this is what I wanted to pay attention in today's video the most. Here is the section that becomes overlooked many times. And this is the section here that becomes overlooked as well. Sometimes even neglected because we get busy. So let's pay attention to the first section here. It tells you here that if your patient has BGL, let me just leave the pen. It tells you here that if your patient has BGL greater than 12, sitting in between 12.1 and 16, notify doctor if 3 consecutive BGLs greater than 12 appear. Okay, if your patient consistently 3 times sitting in this section here, in this gray section here, you need to notify the doctor. And you need to recheck the BGL more frequently when it's above 12. If your patient is sitting between 16.1 to 20, notify doctor if 2 consecutive happens, okay, between these amounts here. If your patient went up to 20 and above, notify doctor immediately. Also on my ward, we test ketones if the patient goes above 15. Okay, we need to test the ketones and write them here to make sure that the ketones are in a safe ranges. Okay, then If your patient, for example, is going from one section to another, to me, it's 3 consecutives as well, because they all are in a high section. So I'm not going to be waiting while my patient only having 3 consecutive here, 3 consecutive here, on goes once here. If my patient is sitting here, whether he's going up or sitting in one line or rapidly going to the 20s, I would notify doctor. If you find that the patient is right away to 20s and he's quite high, notify the doctor right away. You don't have to wait until he reaches 20 gradually. If that happens rapidly, suddenly, you notify the doctor. And this is when people sometimes forget. Do not recheck the BGLs when someone is sitting up, but you need to recheck it. You need to let the doctor know. If the doctor tells you on the phone, I'm not concerned, give, for example, a start dose of a fast-acting insulin and then recheck after 15 minutes, let me know, then fine, you just follow the instructions. But you don't leave the patient sitting with high BGL without monitoring it properly. Then, this section here, it's for your hypoglycemia. If someone is below 4, on their BGL, it tells you here, treat a hypoglycemia and notify doctor immediately. Always on my ward, if someone is sitting below 4, we notify the doctor. Now, where do we find treatment of hypoglycemia? The plan is just on this side of the form here, which is the last page and the last side of this form. If you're wondering why my nails are different, yesterday when I was recording this part of the video, I realized that I've put my finger on a mic on my camera, so I couldn't use that footage, and then I was scheduled to go and do my nails that day anyway. So I'm recording it today for you guys to catch up on this video. Okay, so this part here on the form says hypoglycemia management in diabetes, BGL less than 4. And it gives you here a rule of 15, which is easy to remember when it comes to managing hypoglycemia. It says test BGL and treat with 15 grams of carbohydrates every 15 minutes until BGL is greater than 4. So this is easier way to remember before you go through the whole form. But as every nurse, we need to understand what this form is about and refer to it as a protocol procedure. So let's just start really quickly and go through all the sections of this form. It tells you here literally by answering the questions, following the actions appropriate to it. Is patient conscious and cooperative? If no, you go down here. If yes, you proceed to the next question. So let's say the patient is not alert, is not cooperating with us. So no. If the patient is on insulin infusion, stop the infusion, because what insulin does, it brings your sugars down, and if the patient already below 4, we don't want it to drop it even more. Continue glucose infusion. Usually when patients are on insulin infusion, the glucose infusion would be running parallelly to it together to balance up the sugars, because if you are continuously on insulin, your sugars might be dropping down, but if you don't have any glucose, it won't balance it up. So we will leave the glucose, but we will stop the infusion of insulin. And position patient on a side and maintain airway, because when someone is on a low BGL level, they usually feel drowsy. And here it's important to understand the symptoms of hypoglycemia. You will find some of the patients in a state of unconsciousness or very drowsy, not alert at all. They can't eat as well. They will look really pale and really sleepy. So you need to make sure that the airway, they stay safe in case if they vomit or anything goes in, like saliva or anything to the airway. So you need to place them on a side. So it's like your recovery position. You know, when you do your CPR course, that would be similar. Call a code blue or a medical emergency, which is your med call, and never give anything orally to a patient who is unconscious or drowsy, which is true because this can cause aspiration and you do want to add more problems to already existing problem. If the patient has an IV access, then RN or doctor to administer 30 ml, 50% of glucose as slow IV push. If there is no IV access, then give 1 milligram of glucagon intramuscularly. What glucagon does, It makes the liver to release the storage of sugars into the bloodstream. Then you go down the arrow and it says stay with the patient until they regain consciousness. Recheck BGL after 5 minutes if still unconscious, or after 15 minutes if they regain consciousness. Then if you recheck BGL and it's still below 4, you go back again to repeat the same steps. Obviously, for all of this, you will need orders from the doctors. And because you already pressed the button for the med call, you will have the whole team there writing in the doses and the orders for you as a nurse to follow and give to the patient. So it will be a big teamwork here. If the BGL went more than 4, went above 4, then if unconscious and BGL greater than 4, manage decrease loss of consciousness. If patient conscious, follow up with appropriate oral or IV treatment. When you go here by the big arrow, it gives you here the treatment options. Repeat BGL after 1 hour. Document hypoglycemic episode on a BGL chart and also in a patient's records, which will be your progress notes. Notify doctor to review recent diabetes treatment. They usually do this anytime, because if you have med call the whole situation, they would review all the medications that the patient is on in terms to treat their diabetes. Beware of recurrent hypoglycemia. Risk is greater with oral agents. Doctor must review. So if you've noticed that someone becoming hypo in the morning, just have a look and monitor that patient. Let the doctors know so they could review their medications. Also let the speechy and dietitian know so they could come and review the patients as well, because it could be the reason that the person has maybe gum disease or some sort of discomfort in their mouth, or maybe they have difficulty swallowing, that's why they don't want to eat. A lot of elderly patients usually lose weight, and when that happens, the dentures that they wear start to hurt their gum because they become loose in their mouth and they refuse to eat. And also dietitian can put someone on a resource if their appetite has decreased. Always give follow-up oral carbs or IV glucose after glucagon injection. Okay, now let's go back here and pretend that the patient is patient conscious and cooperative. Let's say yes, they're conscious, alert, and cooperating with us. Is patient on an insulin infusion? If yes, again, you stop the infusion but continue glucose. If patient is nil by mouth, then RN or doctor to administer 30 milligrams of 50% glucose, slow IV push, so similar to this step here. If patient is not by mouth, then give 1 serve fast-acting carbs from the list below, and I'll show you the list in a second. Then recheck BGL after 15 minutes. So remember the difference. If someone is unconscious, you recheck in BGL in 5 minutes. If someone is conscious, you rechecking it in 15 minutes. If after you recheck the BGL is not above 4, then you're repeating the step. If it's above 4, then doctor to revise insulin infusion rate and current glucose infusion. Recommends insulin infusion and glucose infusion at adjustable rate after hypoglycemic event resolved for 15 minutes. So this would be done by the doctor. Any changes to insulin orders, glucose orders, oral or IV have to be done by the doctor. You as a nurse will be just following. And then you go back again here and repeat the process. Then, if let's say, is patient on an insulin infusion? No. Is patient nil by mouth or nil by tube? If yes, then you will repeat these steps here, which are very similar. I'm not going to go to it because they're very similar to the previous ones. If no, they are not nil by mouth, they are not on a feeding tube, then is patient receiving food orally or by tube? Okay, they receive food orally, they can eat by themselves or they have a tube. Give 1 serve of fast-acting carbohydrates from the list below. Recheck BGL after 15 minutes. And then if the BGL is above 4, you proceed down here. If the BGL is not above 4, you give another serve of fast-acting carbs. And then recheck again after 15 minutes. If your BGL went up above 4, follow up 1 serve of slow-acting carbs from the list below. Here is your list below here. You have a column for your fast-acting and you have a column for your slow-acting. And this is what I wanted to emphasize on in this video, because this is where people do mistakes. When they find out in the early morning, usually that happens early mornings, that someone is sitting below 4, they're drowsy, pale, look very sleepy, they load them up with a couple of serves of fast-acting and slow-acting carbs, which then spikes up their sugars before even breakfast was served. And this is wrong. This is why we have this protocol here, so you can follow it up. So you don't give a bunch of different types of carbs, and you don't give multiple servings of those carbs as well. You literally need to follow the instructions here, which are really simple. You give 1 serve of fast-acting, recheck after 15 minutes. If not above 4, give 1 more serve of fast-acting only, recheck it again, and if you finally went up above 4, then you give 1 serve of slow-acting. Now, here are your fast-acting and slow-acting carbs. To the fast-acting carbs, we have a list of 100 milligrams of glucoside, 1 serve of polygel as per directions. We have 150 ml of lemonade or other soft drink. Make sure that it's not a diet one, because we need some sugar in it. 10 glucodine tablets, 3 tablespoons or sachets of sugar dissolved in 50 ml of water, 7 small or 4 large glucose jelly beans. Usually you will find these ones in an emergency kit for diabetes medical treatments. 150 milligrams of orange juice or 30 ml of cordial. Again, make sure that it's not diet, mixed with 150 ml of water. The easiest way that I find for my patients in the morning, those who are alert, cooperative, obviously, can take things by mouth, and they can eat. Normally, I would give 150 ml of orange juice. Sometimes if we don't have orange juice, we would give apple juice, and it does work. We don't necessarily serve lemonades in my hospital or soft drinks, okay, but this works well, just an orange or apple juice. Then if your patient is let's say elderly or have some problems swallowing the food, have been assessed by a speech pathologist and put on thickened diet, then you will use 1 tub pre-prepared thickened cordial, not diet, or 3 individual serves of jam. Jam usually has already thickened consistency, so you don't have to do anything about it. Then if someone is on a PAG or NG tube, you will give 100 milligrams of glucoside, 1 serve of polygel as per directions, 150 milligrams of orange juice, or 30 milligrams of cordial mixed with 150 ml of water. Remember, you only use 1 of these options, not 2, not 3, not all of them, just 1. Then in your slow acting, we have, for a normal diet, we have 250 ml of milk. Just make sure that the person is not lactose intolerant. 1 tub, which is equal to 200 grams of yogurt. Usually most of the hospitals would have yogurt in the fridge. 1 slice of bread, 2 sweet plain biscuits. We always have them on a ward. 1 piece of fruit. Next meal if being served within 30 minutes. And then for thickened diet, you have 1 tub of pureed fruits, 1 serve of thickened milk drink, and then if it's a PAG line or NG tube, then 150 ml of internal feed. Usually they will be on a feed anyway early morning. Some people will be on continuous feeds, but if they are on continuous feeds, they won't have hypoglycemic episodes. It will be very rare. So this is what I wanted to pay attention, guys, not to mix these two, not to load them up, because I see a lot of people doing these things, giving apple juice and then 1 tub of yogurt with it, or a tub of custard. There you go, you should be fine after that. But no, they start to spike. Okay, so this is very easy protocol to follow, and the more you practice, the more you will have your head around it. It will become your habit, and just make sure to practice it correctly, because if you learn it from the beginning the right way, it will become your nature and part of your habits. Okay guys, I hope my explanation and going with you together through the form was easy enough to understand. I've tried my best to my knowledge and ability to explain to you guys and go through through every single section on a form, the way I understand it and the way I practice on my ward. If you do have questions, please leave them in a comment section below. Just a small reminder to you guys that if you do have a patient whose BGL is sitting below 4 and that patient is drowsy, fatigue, a little bit lightheaded but still alert, just to instruct your patient to stay on a bed or on a chair until the BGL goes up, because if they get up and start to walk, they might feel like they had a spin and they might fall, because the sugar that they have in the system is not enough for the body to fully function as a normal person would. So to eliminate the risk of falls, just educate your patient to stay on a chair or on a bed for the next half an hour until you recheck everything and the person will start to feel better. Just give them a call bell in a reach so they could use it if they need anything from you. Thank you for watching these videos. If you do like my content, please don't forget to subscribe and like this video. This will encourage me to create for you guys more videos like it. And I thank you a lot for being on my channel and giving me support and inspiration as well. And I'll see you in my next videos. Bye!